that are different, like for different types of emergencies, where the federal government has the authority to take action where nothing is being dealt with under any other law in Canada. So it is sort of something that can be done. But as already has been noted, you know, the provinces do have a lot of authority that's a little bit different than in other countries. And in order to do that at the federal level, Parliament does have to be sitting, have to be called, and there is a timeline of only 90 days. So it's something that can be done, but, you know, really would supersede what the provinces are doing. So just to clarify that, because I do get a lot of questions about that.
And just back to public spaces and monitoring for a second. So it is something we're cognizant of and making note of. And I'll, you know, personally, I don't want to have to see Knox Mountain closed or the waterfront promenade or other public spaces closed because people aren't adhering to the distancing rules and requirements. But we may have to. It may come to that point. I hope it doesn't. And again, you know, and Steve rightly pointed out that it's up to all of us to, you know, self-police in a kind and compassionate way, not, you know, yelling and shaming people into doing it. But at the end of the day, we may have to take further measures. I hope we don't have to, but it's something that we're watching pretty closely.
All right. So there are some questions that have come in on the Q&A. Thank you, everyone. For those of you who joined us after the beginning, we're going to take questions both from the question and answer that came in from you tonight on the Q&A box, not from the chat, but from the Q&A box. So if you have a question, please put it there. And we're also taking questions that were sent in prior through the Gmail account. So here's one. I am a taxi driver, self-employed, but also my mother's only caregiver. She's 85 and bedbound. Last Tuesday, I had to stop driving cab as I couldn't be sure I wouldn't be bringing it home to her any longer. What I'm wondering is if I'm eligible for any of the government assistances out there.
Yeah, I can actually answer that one. So one of the announcements that was made for EI is so that people could apply for EI, that the waiting period has been reduced, but also specifically for a few things for people that where it's COVID related, where either themselves they need to be quarantined, or if they're caring for someone, or if they're having to look after children because the schools aren't in operation. So it's available for this type of situation that is COVID-19 related. And so you'd be able to apply for EI. The timeline for that would be as of April 1st. And also as part of it, you do have to attest what the situation is, and you have to continually attest every 2 weeks. So there are some rules around it, but there are some options for him.
Okay.
And it's Steve here, just in terms of the provincial support that was announced for people who qualify for any of the federal programs, any of the 3 programs that the federal government has applied or has brought in. If you do that and qualify, then there will be additional top-up benefits coming from the province. You know, $1,000 to every person who is in any one of those 3 programs that the federal government has. So if you qualify there, then you're going to get the additional provincial support, and then there's also some additional benefits coming as far as the BC Climate Action Tax Credit and others that will flow to those individuals who have to access any one of those 3 federal programs.
All right. So looking at the chats and the Q&As, I've been asked to slow down my speech so that you can hear me better. Hopefully this is working. So slowing down my speech, just to remind you that we are not taking questions from the chat box. So if you have questions, please put them in the Q&A box. That would be much appreciated. Colin, this obviously is for you. Has the city closed council meetings?
So we have not closed council meetings at this particular point. We have an option for councillors to video conference in if they so choose. And so we had 4 councillors do that, which then allowed those of us attending physically to have the appropriate separation. But anywhere where the public is invited to attend, so for example, a public hearing to give input, we have actually canceled those. So we have our next public hearing was scheduled for Tuesday, April 7th, and we've taken steps now to cancel that. And the next public hearing isn't, I believe, until 3 weeks after that. We'll monitor the situation, and if things still remain the same, likely that would be canceled as well. So the next public hearing is canceled, but council meetings are still moving forward because we can, as of now, meet the distance requirements, and we also have the ability for councillors to video conferencing if they so choose.
Thank you very much. We'll go back to the Gmail questions, some of which sounds like you've answered, but I'll read them out anyway. Can the BC government give an idea of what would be considered essential services, similar to the Ontario list released today, in the event of further restrictions so that business can prepare in advance? So Ben, Steve, any ideas?
Well, the list is long and comprehensive, Norm. I printed it out, but it's like 8 pages long. So what it is that there's major categories, which I think that businesses that have been named at this point, personal services such as nail salons, hair salons, massage, was one of the ones that recently, was named to close down because of the separation degree that's requested or demanded by the provincial health officer, Dr. Bonnie Henry. But I think that other services that surprise people are hardware stores are to remain open, grocery stores, supply chain management to make certain that day-to-day life, repairs to homes, etc., can still take place. There is a specific list of trades that was not attached to the list, but I suspect that as long as they're keeping the 1 meter distance, they should be still able to operate.
It's Steve here.
Sorry, go ahead, Steve.
And just to add to Ben's comments, in a response to a question in the legislature yesterday, the Minister of Public Safety, Mike Farnworth, indicated that there would be further details and information and announcements coming from the provincial government tomorrow with respect to essential services. So we will have more detail tomorrow. And so anybody that has asked a question about this tonight, we can provide, we'll go through the list and make sure you get the information that comes out that we're expecting tomorrow.
And the only thing that I would add to that as well is the fact that I think that some of the gaps, because of the fact that this is an evolving situation, the ministries and ministers have not yet had a proper or adequate amount of time to define some of the regulations where I think that existing workers are concerned about their own personal health, and they need to remember that separation of 2 meters is what is expected. And I think that more information about that needs to come out, especially from groups like WorkSafe BC. So we're asking that of the government to make certain that people have more certainty about that.
Okay, thank you. So another one from the Gmail was, and this one's a little long, so bear with me and I'll talk slowly and closer to the mic. Despite great personal risk, frontline staff in the nonprofit and social service sector continue to provide essential services to those in need. Frontline support workers, including those who work with seniors, people with disabilities, mental illness, etc., are at great risk because in many cases their clients are not able to socially distance or follow health recommendations. The average median wage for a frontline worker in BC is $20 an hour, which is $3 less than what's needed to rent in Kelowna. So understandably, these were already short-staffed prior to the crisis. Would you support the following measures for these workers? Providing adequate personal protective equipment, such as masks, to all workers on the front line of working in street-level outreach. Subsidies for accommodations, such as underutilized Airbnbs and hotels for active frontline workers, so small teams can reside together without the risk of exposing their families to COVID-19, and increasing funding for nonprofits to maintain or expand services to meet growing community needs and provide for their staff. Example, overtime pay hazard, basically.
Well, I think, Norm, it's Ben here. I think that the first answer is that I think the government announced that as part of its $5 billion package yesterday, that they're going to put more money into some of the services that are like this protective equipment that I think all frontline workers, even people that are working in the private sector, should have access to that. And I think that that's an employer's responsibility. But I do think that that information should be available. And certainly I would support it, as the questioner asked. I think that the other part about that was a novel idea that I hadn't heard of, about using Airbnbs and using that. And I think that that is an interesting idea, and maybe that's something that we can also put forward as something that could be done for teams, especially in those situations where care facilities are short-staffed because of the nature. And I know that there has been shortages, and I think that the idea of specifically targeted groups that are working as charities that are out there that need additional funding. I think if they're providing services at this critical time, as the mayor mentioned earlier, the fact is that they need volunteers. The space, if it was available. So I think it's a more complex issue than just money. So I think I'd have to know more details in the situation before I could commit to supporting that without knowing the rest.
I think the best thing all of us can do at each level is just continue to advocate for their needs. As Ben had said, it's probably more than just money. And I know that all of us have continued to advocate for more resources, whether it be more people, funding, spaces. And so I think just collectively, and I think all of us do a pretty good job working together to advocate. I think it's just continuing to do that. And so from that point of view, happy to continue working with all of you to keep pushing our levels of government for those things.
Thank you. So we'll move on to another question. Tracy, as the critic for interprovincial trade, what is the plan at the federal level if travel is banned between provinces? What impact would that have?
Sorry, you kind of cut out, Norm. I didn't hear the first part of your question.
As the critic for interprovincial, if interprovincial trade is stopped because of traffic stop between the provinces, what impact would that have on the country and our province?
Well, that is extremely important, and especially when we're talking about essential services that we need to get across the country, that is the most important thing. And that's why we've got to be really careful when people have conversations saying, well, we need to just close the borders between provinces, because really, we have to make sure that we've got food going across the country. We have to make sure that we've got medical supplies and other supplies that first responders need, and essential services. So that is one of those things that we have to be really careful of, so that we do make sure that we've got goods and services still going across the country, not only across the country, but also across the border coming from the US, because a lot of the products that we use on a daily basis do come from the US. It's our biggest trading partner, and a huge amount of goods and product go across the border every day. So it's really important that we keep those lines open, but also in a safe way, so that the people that are transporting them can be safe.
Thank you. Okay, so go back to the Gmails. This is landlord tenant. We've got quite a number of questions regarding that. I just summarized it into two. Are there any precautions or possible amendments into existing or recently implemented legislation regarding tenant evictions? Not every landlord is in a situation to cover tenants' rents for any duration of time, and would like some reassurance that rent accumulated can be collected eventually. Some landlords rely on rental income to feed their families and pay their bills. Another question was, my concern is whether the government will have landlords and their mortgages in mind before they say tenants don't have to worry about paying rent. People forfeiting their mortgages will kill the economy. So some comments on the rental landlord situation, tenant landlord.
Norm, it's Steve. I'll jump in first if you want here.
Yep.
Just to say, very good question, and we've heard you've had a lot of questions about that, both I know in this process, but also directly into our offices as we're receiving input from our individual constituents, landlords and renters in the process. So lots of concern. My understanding is that the provincial government, Minister of Housing, will be making some further announcements tomorrow about this and their plan about how to deal with the issues and the impacts that have been raised in this question. So this is something that we don't have a specific answer to at this point. It's certainly input that we're putting into the government around a critical issue that needs to be addressed, and we're all going to be looking anxiously to and with interest to see what they announce tomorrow in this regard, because we have to ensure that there's a balance both for renters and for landlords. Both have very, very legitimate issues and concerns in this area, and we've had a lot of input in it. And so the questions that have come tonight on this issue, we'll make sure those get forwarded on into the decision makers and the people who are considering the policy in this area.
And I can add to that as well, if I may, Norm, from the federal side, that this is a topic that I hear quite a bit, and it is from people that are as well that are landlords, and especially here in the Okanagan and in Kelowna Lake Country, a lot of the landlords are people that have bought recently, as investments, and so they don't really have the room for their tenants to not be paying rent for months, and so on that side, plus for the people that are the tenants, so it is challenging for both people. But at the federal side, one of the announcements that the federal government had made was communication with the financial sector and with the banks. And for them, the larger banks have confirmed that they'll support a 6-month payment deferral on mortgages. But of course, that would have to be an individual conversation between people and their financial institutions. But those conversations have happened so that the banks and financial institutions will be there. But again, it has to go up to each individual person's situation and their relationship with their bank.
Okay, thank you. And just as a reminder for those of you who are watching in some other way than being registered, only those that are registered can actually put questions in Q&A. So hopefully for Friday, when we have our IHA, Interior Health Authority Town Hall meeting, you'll be registered and then you'll be able to ask Q&A to them. Also, a reminder that tonight's not about healthcare questions. We'll keep those to the healthcare experts. Us politicians are not healthcare experts, so we'll keep it to them, and we'll do that on Friday. So another section we have is relief programs. So one of the questions in the Q&A from tonight's observers are, will there be some incentive to extend property taxes until September to ease the financial stress on Kelowna residents?
Sure, and I do have, and thank you for that question, Norm. I do have just a couple of notes that I want to make sure I get across here. Firstly, wherever we can, City Council and City staff are being mindful of people's ability to pay, particularly as this goes further and further. So it's one of the reasons why we supported the free transit, which will continue, as well as the free on-street parking, as well as refund opportunities for those with monthly passes. But in regards to property taxes, certainly deferral is something we're working on. And so the City of Kelowna, as well as a number of other municipalities across the province, have put in a request for the provincial government to expand the current property tax deferral program. So this program would allow residential, business, and nonprofit property owners to defer property tax payments for a period of time. However, this would require financial support from the provincial government. In part, that's because municipal operations rely so heavily on property taxes to provide our essential services such as fire, policing, water, sewer, and others. So that is something that we are working with other municipalities on, and seeing if the provincial government will expand its property tax deferral program. And we'll see where that goes, but we're certainly mindful of people's ability to pay these days and moving forward.
Thank you very much for that. So related to that is income to many homeowners is reduced. And as commercial tenants struggle with business closures and the ability to pay rent and triple net charges, there is a real necessity to extend the deadline for payment of property taxes. So basically you've answered that, but was that on a commercial side as well, Colin, or is that
That's
just
correct.
residential?
That is correct.
Okay, thank you.
Yeah.
Oh, sorry, go ahead, Steve.
Go ahead, Jens.
Well, I was just going to let people know too that are listening in tonight too as well, that the province has announced a number of tax deferrals and measures as well to assist business. So businesses who are would be required to pay the employer's health tax by March 31st. That is being deferred to September 30th. Payments for provincial sales tax, the employer health tax, as I mentioned, municipal and regional district tax, carbon tax, motor fuel tax, tobacco tax are also all deferred to those dates. And there's a couple of PST scheduled increases that were going to be put in place that are now being delayed. That was the tax on carbonated beverages, sweet carbonated beverages is going to be delayed, and some e-commerce transactions as well. And then additionally, on the school tax side of things for commercial property owners and businesses, and that should benefit tenants as well in the classes 4, 5, and 6 under the assessment classification. The assessment amounts for school tax purposes are being cut in half for the 2020 tax year. So that's going to be an additional benefit or savings to businesses on the school tax portion of your property taxes.
Ben?
And if I could just add as well from the federal side, since we're talking about all the different types of taxes, at the federal side, for you to do your personal taxes, that has been deferred to June 1st. Although they do say that if you think that you might be getting some taxes back, you can do your taxes early if you want to get some money back. So you actually don't have to do it until June 1st.
You know, I think that when it comes to businesses that are renting from landlords, I think that the government's relief package doesn't go far enough to help the tenants. I think that they're going to have to do more. I think that there's a lot of small businesses that are going to be impacted severely by this. And I'm not saying, I think that the province is going to have to work with that community to come up with more relief. Talking to some of the landlords in Kelowna over the last couple of days, they can see that many of the small businesses that rent in their complexes are going to be, they already have been impacted. And on top of that, this shutdown that they're currently in, especially if they're in the sector that's not essential and has been closed down, they have lost the revenue during this period of time forever. And many of them are going to have to try to rebuild their businesses back up from a starting point where nobody really knows. So I think that we haven't, we're working on an economic package to request of government that addresses some of the things for small business, and I'd like to see that.
Okay. Recognizing that you are, other than Colin, in the opposition, what are you saying to British Columbia and Canadians based firms that are facing closure and or bankruptcy in the next week or two?
Well, you know what, I think that this is something that, I mean, looking at the program that was announced federally, I mean, it's a lot of money and a lot of debt. But on the other hand, I'm not certain that it's there for probably the largest groups of businesses in the country, not necessarily the small businesses. I think that the deferrals are fine, but I think, as I just said, I think that many of these businesses, when they go to restart, if they can restart, if they've got the resources, are going to need a big hand up to being able to get going again. So that's I think that that's, you know, an important aspect of that, Norm.
Yeah, and on that as well, from the federal side, it's incredibly challenging for people. I mean, I have been on the phone, like I'm sure many of you have been listening to people and hearing their individual stories, and every business's situation is different. And really right now at the federal side, the two announcements that were made were, first of all, a 10% wage subsidy, and also the ability to apply for a loan from BDC. That doesn't necessarily work for everyone. So there is more that we need to do. And just to be aware, what we've announced from the official opposition was a few other ideas. And of course, we did have cabinet sitting today, but I'm not sure what the final negotiations were of that. But a couple of things was that we suggested to increase that wage subsidy, because it's only 10%, to increase that. The second thing that we recommended was to give businesses their GST payments back that they've made over the last 6 months. which would be very helpful for their cash flow right now. And it would be proportionate based on what their business has done. And the third thing is to backstop banks so that they can get low interest loans. And basically they would be covered, they would be backstopped by the government. So those are 3 recommendations that we've made, and we'll have to see what what comes of that.
So Tracy, in a related matter, one of the questions from the Q&A is EI only entitles you to a small percentage of your actual wage. Is there any government consideration in increasing the amount during the COVID-19 crisis?
I know that there's discussions around that, and a lot of people sending in information around that. I can't say what what the decision would be, but I can definitely say that we're getting lots of people making those suggestions. But we'll just have to see what some of the final decisions are. It's definitely something that I've got on my list as a suggestion from a lot of local people.
I think that the other thing, Tracy, I'd just like to add is I think we can't forget about the people that are business owners that have no other income but their business, and we have to make certain that they can get through this as well. They don't have access to unemployment or employment insurance, as it's called now, and I think that we need to try and see what we can do. That's such a huge part of the Canadian economy. We just can't ignore small businesses that are owned by families.
Absolutely, and it's a big part of businesses here in Kelowna Lake Country. It's the majority of the businesses here are small business, and it is definitely a big challenge for them. There's more that we need to do. Yeah. Just
to pull aside to a different topic, but I'll come back to the help topic in a minute. Colin, somebody here wants to know why Parkinson's Rec Center is still open. Why are staff still required to work there?
That's news to me. My understanding is that Parkinson Rec Center is closed, so that's certainly something I would follow up on. Yeah, I'm not sure. I can't answer that. My understanding was that now what may be happening is staff are still going there for work that is ongoing, but certainly it's closed to the public. That I do know for sure. But I would say that right now, and Dr. Bonnie Henry has also stated that business can remain open if it can adhere to the distancing requirements, and people do have the opportunity through the city of Kelowna though to work remotely. So we have given people that choice if it's possible. So I would say that the reason why staff are still going there is because we're able to require or able to provide the distance requirements, and that it's work that is still allowed to be done. But the moment that Dr. Bonnie Henry says that nobody can go to work, certainly we would adhere to that. But that would likely be the reason.
Thank you. Governments at all levels properly have focused on financial impact of the crisis on businesses, workers, and individuals. However, the impact on the cultural sector may be overlooked, with venues closing or closed without revenue from ticket sales. The impact on theater, dance, and performing arts groups could be disastrous. What are your comments on that?
Well, Norm, yesterday's package by the provincial government has $1.7 billion earmarked for tourism and culture to try to address some of those concerns. They don't have the answers yet, but what they are putting together is a panel to advise government on how best to support those sectors. As you can imagine, the cultural side, equally the tourism side, has been devastated with the closures and restrictions. And I mean, this community itself in the central Okanagan here really depends on it. So I'd like to think that they can get a plan together and help support the cultural arts.
Anybody else?
I think I just appreciate the question, and we'll definitely be mindful of that moving forward. I mean, there are so many things that, well, everything is impacted by this. And so it's just important to be mindful of those things. And certainly arts and culture is a strong pillar of our community, and we want to make sure that it remains as such when we get through this. So I just appreciate the question, because it's just one more thing to keep on top of.
Yeah, it's Steve here. I'm starting to see a little bit from some of the organizations too, very innovative ways to continue to help support their efforts through different means during this time period. And I think it's important for all of us as citizens of the community to help support those efforts. I saw a note tonight where the Central Okanagan Foundation is going to be doing a virtual gala, which will have all the elements of a gala event, but it'll be done virtually. So food will get delivered to your house. There'll be the processes that we see there. So as community members, where we can, and we need to continue to support these organizations. I think all of us do that with their regular processes. We just have to recognize during this time frame that we're going to need to do that in different ways.
Mm.
Yeah. And if I may, just because they did ask for comment from all levels of government, that I do agree that it's, you know, and I've been talking to lots of people that work in the not-for-profit sector and in the arts and culture sector, and very, very similar concerns to small business. And I think whatever we do for small business, we should be also, you know, looking at for the not-for-profits. And, you know, right now, what they do have the ability to do for the 10% wage subsidy, but if you've laid off all of your, you know, all of your staff, or you're not open, they can't really utilize that right now. So it's definitely something that we need to incorporate, very similar to when we're having these small business discussions.
Tracy, what about people who are self-employed? Are they eligible for EI? The government made any changes so that they can get the EI?
That's a great question. That was one of the things I had mentioned a little bit earlier, where there is a program that the government is looking at implementing, but all of the parameters around that haven't been set out yet. So we're waiting to get information on that, but they have said that people that traditionally wouldn't be applicable for EI would be able to apply, but we don't have all of the parameters around that yet. So we're watching for that.
And has anything been announced provincially or federally to help seniors through this time? People who are not going back into the workforce, that have been retired?
Well, one of the things, Norm, yesterday on the announcement provincially was that they were going to review the rental subsidy for low-income seniors here in the province, SAFER, and also the RAP program, which I need reminding as to what that acronym stands for. But anyways,
rental assistance programs.
Yeah,
program.
Right. So they're both being reviewed, and the idea that you know, that seniors, at least that support will be hopefully help them get through this time.
Okay. Tracy, Steve, anything else you know of?
I haven't heard it.
No, a lot of the provincial support yesterday that was announced was to organizations that support seniors. I think that comment came up earlier around the not-for-profits and the organizations needing more support there and providing the services. In terms of specific income support to seniors, haven't seen that specifically in it, although we do know that there are various measures being taken for deferral of payments. BC Hydro is going to be coming out with a program to defer your payments. ICBC is coming out with a program to be able to defer, if you're on a monthly payment plan, your premiums. So there may be within all of those measures that are more broad, not specifically targeted at seniors, targeted more generally, but will benefit seniors during this time frame as well. If cash flow and meeting obligations becomes a challenge.
One of the
Sorry.
Go ahead.
So not a specific program per se, but for seniors, there's a couple of things. There is the increase in GST for people that are applicable for that now that I mentioned earlier. But also for seniors would be that reduction of the requirement for what they're able to pull out of their RIFs. And so that is for retirees. It's not a specific, you know, payment program from the government, but there is some adjustment there that might be useful for some people.
Yesterday, Carol James announced $50 million for the United Way to help programs like Better at Home, which is a program for predominantly seniors, correct?
Yeah.
Have you heard of anything, any programs that are going to be in place to help vulnerable working aged disabled people, and their families? Nothing yet, eh? Okay, well, keep that on your radar if you have a chance.
Yep.
I have a note from a lady here. She says, we are two immune compromised disabled women. We have had to fully isolate, and we have support systems to help us, but we know that there are other vulnerable disabled people who don't have supports. They often they get care at home, and those care assistants are no longer working for various reasons. So there's obviously an opportunity here for people who have those kinds of challenges. Steve, you wanted to say something?
No, I was just going to say, Norm, on those kind of questions, I think one of the things that's been really valuable about this process for us is to have all of those concerns and input come in directly to us. These are the kind of things that we can take forward, and I know Norm's we're going to be doing the follow up on that, and I expect that all the questions that are coming in on the Q&A process that don't get addressed tonight we'll be following up on as well. So this is it is really good to hear directly from our constituents and the people in our community about those specific issues, because that helps us in our advocacy role, whether we were in government or not in government, to be able to understand the full impact of all of this, and to make sure that we can flag these issues as we go ahead in the weeks and months ahead, and look to how we refine or how we advocate for refinements in current levels of government response.
Great, thank you. And that's why we asked for people's contact information and their postal code when they registered, so that each person here can identify if they're a constituent and get back to them if they care to. And yes, we'll for sure share all these questions with all of you afterwards. But again, I just want to remind our participants, not our panelists, but the participants at home, that if you have a health question, we are going to have a panel specifically with IHA leadership on Friday at 6 p.m. So that health question you can ask at that point, or send it in via email to a different email address, which I will tell you right now is askihtatownhall@gmail.com. askihtatownhall@gmail.com. So be first, get your questions in, or wait and register for the town hall. Not yet, because it's not up there yet. Probably in the next day, we'll get that up at the Team Okanagan website, and you can register for the town hall with our CEO of IHA and our Chief Medical Officer of IHA. And the IHA town hall will be IHA wide. It'll cover every part of the province that IHA is responsible for. So you are getting advance warning before all the other places get to know about this. So hopefully that'll give you opportunity for questions. Colin, will the city remove the parking restrictions for a time being around the cancer center and hospital so that staff and patients can worry less about where to park?
So as of now, no, because part of our challenge is still having enough turnover to allow for people with health issues to be able to find a place to park. So at this particular moment, no, there are no plans to, but of course this is fluid and we'll adjust accordingly. But our concern would be that the immediate area is parked solely with staff, and therefore those who actually want to visit the hospital to receive treatment won't be able to find a place to park. And I know that that's a challenge as it is already, and it would just be compounded with staff parking on all of the streets. So right now, no. But it is fluid, and we will adjust accordingly if we need to.
And here's one for you, Colin, that an idea as opposed to a question. Kelowna Library has a 3D printer. Is it being used to create medical supplies or essential supplies? They are doing it in other countries. We'd love to see Kelowna. Maybe you could.
Sure.
Steve.
Something to consider. It's worth asking the question. Absolutely. I don't know the answer. I'm willing to ask the question, though. Absolutely.
Yeah, Steve, was that a dry cough?
No.
Oh, good.
No, I'm fine. I was just going to jump in at Norm and say that just got a notice on our internal communication system that Selena Robinson is going to be making an announcement at 1:15 tomorrow afternoon on the housing rental issues. So as a follow-up to the information we gave a little earlier about expectation that something like that was coming tomorrow, we now got official notice that she's going to be making that announcement at 1:15 tomorrow.
Yeah. One question is for me. Do I need to resend medical questions? It depends. If you sent them in today already, they should be fine. But if you want to make sure, just yes, resend your medical question just to be absolutely sure. What can you tell us about the federal funding that has been made available to small business through the BDC? And any word on how quickly it might be deployed to look businesses that are suffering shutdowns to help? I think that's
Yeah, so I can answer that. So that program has been started now, and so it is available for people to be applying now online. Now, of course, there are different parameters around that, whether or not someone's business might be applicable or not, but it is available online now, right through the BDC website, and you can apply. Yeah.
awesome. Thanks very much. Question from Gmail. Is there the possibility to have the provincial government speed up their payment terms and processes for suppliers already doing work for various provincial agencies? In other words, can the government pay faster? Maybe even advance payments on approval of contract or purchase order.
Well, I think that Norm, I think that Steve and I have been working on that, and we see that was a question that we saw earlier today, and we think that it's one that we should be recommending to government about the timeliness of payments on their BC procurement website. And I think that it's a good idea, and especially when you can get cash into the hands of businesses faster, it does mean that it's there to help get them through this crisis.
Could you please explain more in detail about the $1,000 check that is being issued to those on EI due to COVID-19?
It's well, first of all, it's not no, we didn't. Well, we know it was in yesterday's announcement about what they're going to be doing. So I think in an earlier question, there was a question about what we were, what's being done provincially to help people that are out of work going on to EI. The province is offering $1,000 to all people that are going on to EI as a one-time payment, in addition to the other deferrals of taxes and deferrals on the carbon tax and the taxes, PST increases that Steve mentioned. And I think that generally, it's going to everybody that is eligible for unemployment insurance.
Yeah, so it's on the eligibility for the three programs that are in place, either EI, employment insurance, or the new federal emergency care benefit, which is one of the federal programs that have been announced, or the new federal emergency support benefit. And as Tracy mentioned earlier, we don't know all the criteria yet for those three programs. That's the process they're dealing with in Ottawa tonight. But once those details come out, and people who are eligible for those programs will automatically get the $1,000 additional payment from the province if you're an applicant and eligible for those programs. And one other little quick note on it: it is the payment is tax-free.
Thank you. How can the average citizen help? I know we've been talking about self-isolating, staying 6 feet apart. And volunteerism, Colin talked about that. What else can all of us do, all of us citizens that are in this situation?
Well, Norm, to your earlier question about seniors that are in a situation where they have supports, it's the people that don't have the supports or the network that need to have either neighbors or friends call and check in on these people that are in a situation where they maybe can't get out to get some of the groceries that they need or other things like that. So I think that that's one of, next to the other things we should all be doing with COVID-19, I think that that's probably one of the things that we could do in reaching out and being more than neighborly, making certain we're reaching out to people that may need help on a much more urgent basis.
And as Steve here, support local business at this time. Support those local businesses in our community. They're still working hard to stay operating. The takeout, have takeout food. Make that order and go pick it up from those family restaurants and businesses that are doing that. That's a great way to support them. So at this time, we all need to look into our community and see how we support the businesses and the organizations where you can volunteer, the And as I mentioned earlier, the creative ways to help support our cultural and arts groups in the community. We all need to do our bit to help support the community locally.
Two things I would say. The first being that RCMP and bylaw enforcement can't be everywhere. They can't be enforcing, the social distancing requirements in every possible scenario taking place in our community. So I would ask that we all do our bit to play the role of enforcement. And when you see people who maybe aren't adhering, just politely remind them. I would also say that this is an opportunity for people to be the eyes on the street, so that if you see something that's suspicious, call it in so that our law enforcement, if they are needed, can look after it. The other thing I would say, and I know this will be a bit cliche or a bit cheesy, but we need to just be very empathetic and compassionate, because people are scared. People are scared of getting sick. People are scared of losing their homes. People are just really not in a good place. And so just be kind and remember that if you see someone having a bad day, we're all really struggling to get through this. And so just before you react, maybe just take a second to think, and perhaps the way you'll react will be a little bit differently, because everybody right now is just really scared and tensions are really high. And now more than ever, we just need to be really empathetic and caring and kind to one another.
And if I can add on to that as well, I think that we all need to reach out to people that maybe we haven't reached out to in a long time. Get out your, look through your phone and connect with people that maybe you don't on a regular basis. I know I've been doing that a little bit in the moments here and there. I'll phone someone that I haven't talked to in a long time, especially someone that, might be alone. It's really important from that social isolation point of view. And also there's a website, Do Some Good, that you can go on, and they've got some different suggestions on there of different things that you can do. Order items online from our local businesses, and support our local restaurants, the ones that are operating, that are delivering food, support them, because they really need us more than ever right now. And just give a helping hand, and know that everybody is quite on edge right now. And so it's really important that we all come together and that we stay strong and that we help each other as much as we can.
Thank you. Is there a list somewhere? Can people go to some website where they're collecting all the volunteer opportunities and putting that together? Anybody know of that? Rather than having 10 different, repositories of what's needed and who wants to volunteer, is there one site, Colin? Does the city have a particular place that you're collecting names? And
I know that there's a lot of Facebook pages that are up and running. So I would say that that's one good thing about social media right now, is there's no lack of pages in our community right now where people can be matched with resources, or people who want to help get groceries for people or other things. So I would say look for those opportunities on social media at this particular instance. I think you'll be able to connect pretty quickly to people looking for help.
Okay. With tens of millions of dollars being thrown around from federal to provincial for assistance, is there a central place that people of various positions can navigate what assistances are available and how to access? So,
you know what? I think that probably that's one that we best respond to. The website address. There's a simple one for the both the province as well as the federal government, and I think it's probably best that we answer that in writing.
There's also, it's Steve here. There's also and I haven't had a chance to completely navigate it through, but the provincial government just put up a new app today, a COVID response app, which I think is meant to do two things: provide all the information from a health perspective in a single point, but I understand it's also to include the links through to being able to access the resources and programs that are in place. Some of this is all getting built now because the details of the programs are just starting to come out. And then there's always the provincial government website and the federal government of Canada website have prominent links through to the programs on their front pages and on the websites. Or you can contact. We're helping lots of people in the through our offices, through our constituency offices, who are all still working. They may be working from home, but they're still fully engaged in responding to individual requests, and we're helping direct people to the appropriate links and to where they can get information on the program. So I'm sure you can just contact any one of our 3 offices, or Tracy's offices, or Dan Albus's office, and they'll help you get, our constituents instance will help you get links through to the right place to try to find the information that if you're not able to access it yourself.
Yeah.
Thank you.
If I may, Norm, can I just add on to that? Exactly. I mean, this is what we're doing. This is how we're corresponding and serving people. And so my entire team, both here and in Ottawa, because of course we're not functioning like we normally do in Ottawa, is working on constituency work all day, all night. You know, at the end of Saturday, I looked through our email, and literally we had an email going out almost every minute. So it is those individual connections where people might say, okay, this is what, how do I find out, or how does this apply to me? And we can kind of piece through the different sections and then send you the applicable parts, because it is quite a monolithic effort to kind of look through everything. And we're also sending people provincial links as well. And I know that, that the MLA offices are doing that as well. We're all working very collaboratively. So you can go on each of the provincial or federal sites and look through, but if you do have something specific, reach out to us, and we've already got things pieced out that we can send to you very easily.
Yeah, and I see through the chat box that people are sharing the connections, and I also saw that our techie in the bottom right corner flashed up the website. So I think we've helped a few people tonight. As somebody who lives near playgrounds, one writer says, what do we do when we see individuals breaking the rules and still using parks? Do we call bylaw?
Sure. So I'd like to thank that user for that question. So what I would suggest to that user is that, again, I mentioned it earlier, we can't have police or bylaw in every single park. So I would encourage that user, if he sees something like that, to perhaps kindly suggest that the social distancing isn't being adhered to, and for everybody's sake, to please adhere to it. But if it's somebody who's uncooperative, or if it's more than a couple of people, if it's a large gathering, certainly I would recommend maybe calling the non-emergency line of the RCMP or the City of Kelowna bylaw line, and we will make sure that we can get somebody out there if possible to break it up and to remind people that this is a serious issue that isn't to be ignored.
Thank you. So this one's a little more technical. What do people do if they can't reach their banks or are denied deferrals? Why don't the big banks have an online option for people to apply for those deferrals? Many people are being denied because their mortgages are too new, and the banks are using this to reevaluate your ability to pay in the future, giving them the right to call in your mortgage. Tracy, you have some experience in this?
Yeah, I think what I'll do is I'll take that one away, and I know that there's different information that I'm sending forth to different levels of government and within us as a shadow ministry as well. I also do sit on the National Credit Union Caucus, and I do have connections there from because of sitting on that committee. So I think that is a valid question, and that's something that I can bring forth.
Okay. How do we force people in a 55+ building self-isolate? 3 separate people have traveled abroad and will not self-isolate. Everyone in that building is terrified to leave their apartments. Help! Exclamation point. The RCMP said they can't do anything.
That's interesting, because my understanding is under the authority of the provincial medical health officer, people can be forced. And so that's something perhaps I could follow up on.
Okay, and we can also ask our health authority folks on Friday about that as well.
Mhm.
Norm, can you add in some of these links on your Facebook page? Sure, I think maybe we can all add in the links on all our Facebook pages, but I'll leave a note for my techie in the bottom right corner. Son, can you make sure I add some Facebook links on that? Thank you very much. Is there a plan to resume some workplaces with legislated rules to ensure safety for all? For example, road repair crews could possibly go back to work with strict work-safe legislation. Also, grocery stores. I went to Costco yesterday and I thought they were doing a great job of protecting staff and patrons. However, I believe there is room for improvements, possibly through work-safe legislation. So the whole issue of making sure that those key services are still available to us as long as they keep their staff safe. Any comments on that?
We'll take our cues from the provincial medical health officer. So
Yeah.
if she
Good
says
answer.
that that's possible, then great. But until then, as you said off the top of the show, Norm, we are not medical health experts. And so, yeah, a question better suited to those who can say when it's safe to go back to work.
Mhm. I think that the other thing that that question asked, Norm, is amendments to work safe, the legislation. And of course, the legislature sat briefly yesterday to pass 2 bills. And I think that it's going to have to be under the framework of the provincial health officer's ability to, if there needs to be, if this was more extended, then hopefully it's going to be. I think that hopefully we can work with people like WorkSafe to find appropriate guidelines and being able to make certain that maybe those essential services are able to operate.
Someone wrote that there's not enough staff to work at shelters. I think Colin talked about that before, that volunteers are not as many as before. There are not enough trained staff, period, in town, so extending the length won't help as it's not safe. Would you support long-term mental health and addiction residences in the Okanagan? I think I know where this is going to go, as that is where they should be rather than shelters with untrained employees. All right, don't all jump in on one on that time.
Wow. I think it's safe to say, although I don't want to speak for everybody, but we have all been advocating for mental health and substance abuse facilities and treatment. So I think that goes without saying. Of course, we would support those things moving forward.
Yeah, it's Steve here. This is something we've been advocating for, even before COVID. So COVID just puts added focus on all of this, but this is something that we need in our community longer term, whether we were in this particular crisis situation or not.
Yeah. And if I can just add as well, this is something personally I've been advocating for at the federal level. So, and I know that all 3 of us in all levels of government that consider this important.
Okay. In my opinion, all levels of government are not understanding how fast these layoffs are occurring. Companies will shrink to almost nothing and incomes will disappear. A 10% subsidy for wages from our federal government will be almost meaningless. Look what other countries are doing now. Comment, please.
Yeah, I agree, and I spoke about this earlier, that it's a 10% subsidy when you're laying your staff off isn't overly helpful. And so some of the things that we have put forth as recommendations as the official opposition was, first of all, to increase that wage subsidy. The second thing that we recommended was to give businesses the GST back that they have paid over the last 6 months to help them with their immediate cash flow. And the third thing that we've recommended initially is for the government to backstop loans so that they can get low interest loans to help them. Those are 3 of the initial recommendations that we've made. There are other things as well. That's what we've put forth, but we'll just have to see what Parliament decides. Yeah, but I agree.
Vancouver is locking down pretty tight. Now, Vancouver has their own charter, which is different than the rest of the province. So they can make some rules that the rest of the province can't. So that actually might answer the question. But What measures do you anticipate occurring in the Okanagan more than what we have currently?
Well, I'll jump in and say that, again, we're, like most municipalities, taking direction from the provincial medical health officer. I'm hoping that we will hear something on non-essential business, because I don't know about all of you, but I am getting a lot more emails from people saying they'd like to see more done in order to prevent or flatten the curve. So we'll have to wait and see. But we've seen Ontario and forgive me, I can't remember all the other provinces that have closed non-essential business. I suspect it won't be long before our provincial medical health officer does the same. And then we'll go from there. But you know, this is again changing every single day.
Norm, why aren't you participating as a panelist? Well, the answer is I got all this technology that I'm trying to coordinate, plus all the things that are going on here in your questions. So that's why I chose just to moderate. But thank you for that. I think we have some great panelists with the people that we have in front of us. They don't need me to help them out. Please ask Tracy about RRSP tax-free withdrawals with limits, of course. Tracy?
Yeah, so that is something that I know people are suggesting. It's not part of the initial plan that the government had put out, but I know that I've had a fair amount of communication from a number of people making that as a suggestion, and it is something that I do have marked down as a suggestion that I've actually put forth already to our Shadow Minister of Finance. So you know, definitely as people have these unique types of suggestions, definitely send them forth, because that's how we get good ideas is from hearing from you.
A writer says there is a Kelowna People's Alliance that have a place to sign up to volunteer for a couple of local agencies still running, and also as a neighborhood connection point. So she says, sorry, it's not a question, it's an answer. So there's a Kelowna People's Alliance. Another one offers https://bc.thrive.health. bc.thrive.health. I assume that's another resource. I would like to know some preventative measures. What have YVR and YLW done to help screen travelers? Any thermal imaging equipment in place to detect the virus at the airport? Well, I can't say anything about YVR, but Colin, the city owns the airport in Kelowna.
Yeah.
What measures are you taking to help screen travelers, if any?
So again, following Canadian and provincial protocol when it comes to health protocol, taking the advice of medical health experts in regards to those particular measures. And as you know, flights now are fairly limited. So we have very few passengers moving through the airport, but those that do have to adhere to Canadian and provincial medical standards and testing in order to get where they need to go.
Thank you. So far, I've not seen the big banks adjust their lending rates in response to VOC rate reductions. What steps can government and opposition take together to force the banks to play a meaningful role? They are profiting on the backs of small business and clients struggling with lines of credit and overdrafts.
Yeah, so I mean, this is something that I do hear about. Also, as part of that, I do get communication where people are saying, you know, for credit card companies that, you know, that they continue to charge the high interest, you know, from credit card companies. So it's all part of that. I think it's a matter of using that from an advocacy point of view. It's, you know, it's not something that is part of the current federal government's economic response plan. That is something that I will take away and will add to, you know, to suggestions that we get from people, for sure.
How will deferrals help landlords from the big six banks when deferrals are for primary homes only?
Well, it's Steve here. I think you know, the deferrals on that side of it again, this is something where the whole question around the rental side of it, landlords, businesses, is something that has to be addressed. It's part, we're hearing lots of it. There was a question earlier about, how fast layoffs are happening and things like that. We're certainly hearing it and continue to advocate. We supported earlier this week in the special session, the legislature supported the spending package that was announced by the government and took the extraordinary measures to move that through the House in one day to allow that spending, that $5 billion in spending, to come forward. But we also made it very clear in supporting it. We also said that more was going to be needed, that this was probably likely only a first step in what was going to be needed to address the impacts of this, both shorter term and longer term. So the kind of input that's coming in tonight are giving us lots of issues and impacts that we need to continue to take forward and continue to advocate for in our role of holding government to account. Tonight's not a partisan night in terms of responses and things like that, but clearly we're all in this together, and we need to work to take these issues forwards and to look to have governments respond as is going to be required, because I think the impacts are just starting to be felt.
So at the outset of this, I started right away with the questions. I'd like to have an opportunity to finish off with hearing from each of the panelists some final words, which when I invited them on, I actually said they'd be introductory words, but I forgot all about that piece. So if we can go around the room, so to speak, and if you have something that you'd like to say, now's a good time to do so. If we have any time after that, I'll add a few more questions, but I would imagine we'll use up the rest of the time. So please go ahead. When we start, we'll start with Steve, and then we'll go to Colin, Tracy, and we'll end with Ben. How's that?
Well, thanks, Norm. I probably don't need to add too much more. I think I almost made my final comments in that last intervention I made. But first of all, thanks you, Norm, for organizing this, hosting us, and thanks to all the other panelists for their participation. As Tracy mentioned earlier, we are all working in this together very collaboratively, and we need to continue to hear from you. I want to thank our office staff, particularly our constituent assistants, who are doing yeoman service right now to the community in terms of helping respond to all this, working under different circumstances than they normally work at. It's not quite as cozy and fun as being in the office, but they are all working hard. So thanks to everybody in the community for your participation tonight, and we'll take all of these questions and input and take that forward, and don't hesitate to continue to contact us. This is a great community, and we'll work together to get through all of this and come out the other side. Thanks.
So, is that me? Is it my turn?
Sure.
All right. I'll just reiterate the thanks again to Norm for organizing this. The sincere thank you to our frontline healthcare workers, to the support workers, enforcement, people keeping our food supply chain moving. This is just unprecedented. And as I mentioned earlier, people are really scared. It's an emotional time for a lot of people. So just encouraging everyone to look out for one another, and please take this seriously. There are some people in our community who still are not fully believing that this is going to have a big impact on our community. It already is. So please take this seriously. Keep the appropriate distance away from one another, and let's do the best we can to get through this, and then rebuild together. Thanks.
Tracy?
Oh, so I just want to thank you, MLA Letnick, for putting this together and coordinating all of this and coordinating all of the technology. I just want to say that, you know, to thank everyone in the community that is helping in whatever way that they can. I want to say that my heart goes out to everyone that is affected, and each one of us is affected by this in a different way. And just recognize that that we support each other. Know that I'm working very hard. Everyone at my entire team is working very hard. If you want to reach out, just in case you need an email address, it's tracy.gray@parl.gc.ca. If you have any other specific questions, you can phone as well, 250-470-5075. Probably the best ways to reach out, and we will respond and try and help as best as we can. And I know that we're just such a great community. We have an incredible human spirit, and it's opportunities like this where we can come together and hear what's important to people, and just keep the communication lines open and keep the ideas coming. And we'll work really hard for you. Thank you.
Okay, Benjamin.
Thanks. Thanks everybody for joining this. I have to say that I noticed that we peaked at almost 300 people online here, Norm, and I have to say that considering the last virtual town hall, this has been a great success. And no, I mean, I think that we're going to be doing well. I know you've got more lined up, and this is a very good way of getting community input for the ideas that we need to take back. I think that everybody that has taken the time to be a part of this tonight, your questions and your suggestions, which I've seen flashing up on the screen here, are something that we will make certain that we try to get answers to, but also we use the ideas to move forward as we're trying to influence and shape the outcome of this particularly difficult pandemic attack. And so I think it would not be fair to not let you all know that Norm, who's been our health critic, has been on the line working as hard as the minister and Dr. Bonnie Henry in terms of trying to make certain that our side of it we're kept up to date. And I'm sure that his event on Friday will be outstanding with the Chief Medical Health Officer from IHA and Susan Brown. And I just want to make certain that you realize that our office as well, although it's virtual, the two staff that I have are working their hearts out trying to get answers to difficult questions that we don't always have the answers to. And I look forward to, if we don't have the answer, getting you the best available information as soon as we do have it. And hopefully we get through this soon, and that you reach out and help somebody in your neighborhood, that senior or somebody else that you know. And I do want to mention Canadian Blood Services is looking for people to donate blood. Go out and call the blood donor clinic. They need help now, and that's one thing you can all do to help somebody else.
Thank you, Ben. So I'd just like to conclude by thanking all the viewers. Thank you all the people who registered. Thank you to all the panelists. You guys are great. We've worked together for, I don't know, 12 years or longer, and never thought we'd be working together like this. But it is what our community needs. They need to get answers to their questions in real time, and you did it. You did a stellar job. Really appreciate that. Appreciate my staff, of course, who are helping our constituents. Appreciate JP, who at the bottom corner, who's our techie tonight. Thank you, son. And appreciate my wife. By the way, that's her painting in the background there. Anybody wants that? It's just been an outstanding pouring, I think, of our community to help one another. We're just at the beginning of this. There is a reason why the provincial government has canceled most of the elective surgeries and moved people out of the hospitals who don't have to be there. Those empty beds aren't there just because we like to see empty beds. Probably things are going to get worse before they get better. So I just want you to keep your spirits up. Make sure you continue to follow the advice and the rules of Dr. Bonnie Henry. She's doing a great job. So is Adrian Dix. We need to continue to support them and make sure that we are in this together and come out the other side of this together. So by all means, help your neighbor, contact them, and share the love, and be safe out there. We're going to come back at 6 o'clock on Friday with Interior Health. There'll be stuff posted tomorrow, so you know how to register, and focus your questions on Friday for Interior Health as opposed to government services, which you did tonight. So with that, it is 7:58, just about on time, so I won't add any more questions. Thank you, all of you, and good night.
Thanks, Norm.
Good night.
Thanks, Norm.
Thank you.